Yeah, sorry, new technology. 6 p.m., public hearing to order, ordinance regulating barbering, hairdressing, cosmetology, nail, tanning, tattoo, and body piercing salons. So we roll call Madonna. Thank you for being here.
Mr. Barnes?
Present.
Ms. Cantor?
Here.
Ms. Casperson's absent. Mr. Davidoff?
Here.
On the phone?
Yes, I'm here.
Beth Kerrigan?
Thank you, Madonna. Let's have a presentation from the town manager. Thank you.
If I could just say, we have our Director of Health, longtime Director of Health, Steve Hewlett, and Amy Eberly from our Health Department. They're going to come up and... Kraus. She got married. Not yesterday either, so... Amy Kraus and Steve Hewlett, they're going to do a little presentation on what this ordinance does. So you want to come up to the...
Okay, I think I pressed to speak. I think I read that directions correctly. Okay, good evening. Thank you, Ron, Madam Mayor, members of council. Thank you for hearing this ordinance tonight. My name is Steve Hewlett. I'm the Director of Health with West Hartford Bloomfield Health District. Our offices are located at 580 Cottage Grove Road in Bloomfield, Connecticut. And with me to my right is Amy Kraus, our Assistant Director of Health. So I'm going to give a sort of overview of the ordinance, why this ordinance, why now. Amy then will address any particular technical details, as she is really sort of the architect of a lot of the ordinance itself. And certainly we owe our gratitude to Corporation Counsel's Office for their support in what has been perhaps a couple years of development of this ordinance. Take off my glasses. So anyway, as the mayor introduced it, this is the ordinance regulating barbering, hairdressing, cosmetology, nail, tanning, and body piercing salons. This time frame has added more state regulations as we've gone along, so that's how this ordinance is all of a sudden seeming to be capturing more things. So we thought it'd be better to just have it all in one home than to have a lot of little ordinances. So from that nature, it was a strategic decision to try to bundle these up. So again, that's sort of what took us some time, is to find out, well, what's crucial across these various salon activities. The intent of this ordinance is to establish in the town of West Hartford standards for the Director of Health or his designee, my staff, to be able to regulate and enforce the sanitary conditions of the referenced salon establishments that we just talked about. This came about because the state of Connecticut statute was passed at least 10 years ago. Pat might even have better knowledge than I, but it's been quite some time. And it's 19A-231, specifically subsection 1, subsection small b, that states in part, the Director of Health for any town, city, borough, or district Department of Health, or the Director's authorized representatives shall inspect all salons within the Director's jurisdiction regarding their sanitary condition. It goes on to further state, if any salon upon such inspection is found to be unsanitary, in an unsanitary condition, the Director of Health shall make a written order that such salon shall be placed in sanitary condition. So what has taken us so long is we had no defined sanitary condition or unsanitary condition. So what this ordinance is trying to do, the proposed ordinance, is trying to establish a uniform set of standards for the salons in West Hartford. The ordinance also sets the requirements for a permit, for inspection, and how enforcement activity will be conducted. And additionally, it looks to hold the owner of the establishment responsible for these activities, not necessarily the individuals that are practicing the salon skills and technicians that are there. They are licensed by the state of, many of these professions are licensed as individuals through the state of Connecticut, so we're not looking to put them in double jeopardy, but we are looking to make sure that the owner hires qualified people, keeps people trained, and keeps the facility in good shape. The approach taken is similar to the permitting, inspection, and enforcement of the sanitary conditions of the massage establishment salons that I believe is chapter 117. I didn't double check that number, which has been very effective, and I think from the massage establishment's point of view, very successful for them, and has done a good job of, I think, making sure that people that are patronize the massage establishments have a meaningful and appropriate allied health experience at these massage establishments. Excuse me. The salon also includes specific sections on definitions, plan review for newer renovating renovating salons, how the permit requirements are, fees, inspections, general sanitation standards, and specific sanitation around certain specific operations. For example, tattooing is different than barbering. So there's some components where inside the ordinance we highlight those unique characteristics that might apply just to one. But for the most part, they're general sanitary standards that apply equally to all the facilities. The salon ordinance also provides appropriate due process for anyone that's aggrieved by any actions that I take as a health director or that my staff take. There's appeals process and rules as to how we conduct the hearings there. So due process is built into this as well. We did a survey for tonight just to find out in the greater Hartford area how many of our neighboring towns already have regulations in place. And as we stretch that circle around greater Hartford, 25 of the municipalities around us already have an ordinance in place, and there are 5 that do not. West Hartford and Bloomfield being 2 of those 5. And we're here tonight hopefully to make that 4 and 26 regulations approved in the near future. And we will do the same on our Bloomfield side of the street based upon what happens here in West Hartford. I won't bother to read you the 25 towns unless somebody really is curious. In the process of drafting the West Hartford Salon Ordinance, we did review the language and best practices of many of these towns, specifically the ones that had, there were towns similar in comparison to West Hartford or similar in the health services programs that they run to what we ourselves run and what we expect or what is expected of us by the town of West Hartford. Several drafts of that ordinance were made available during the comment period, and we solicited comments. We kept it on, we put it on our website. We opened up a way in which people could actually post their comments on our website to us, and we'd go and see if that was going on. We worked with the Chamber and the Merchants Associations to try to identify who the salon establishments folks were, and when possible, we provided hard copy to them. When possible, if they asked us to come and review their establishment, we did that. Amy made several inspections with operators and owners just to see how the ordinance would actually play out. And we conducted several listening sessions where we just simply hosted, or in this case, the Park Road Association and the good folks at the Playhouse allowed us to use their facility on a Monday, and we invited all the providers in the area to come in and just tell us what they thought. So we listened to what they had to say. And with each iteration of that, we made some more adjustments, some more corrections, some more improvements to the language of the ordinance. At each step, whenever it was appropriate to improve it, we did. By same token, we had to keep in mind it is still some enforcement component. We can't take that part out. I think some would have liked that. But we had to leave that back in. Over that 2-year period, the majority of all of our feedback was positive. From both providers and patrons. I don't think I had a patron not say, oh, that's a good idea. Or you start hearing, well, you know what happened to me once. So you hear a lot of those kinds of stories along the way. And I'm not saying those stories won't continue, but at least now we have a reason to go and talk to the owner and find out what's going on with that story. They showed throughout that whole time, they showed their understanding of why we needed to do this. They understood that we are in a place where we have to do it, but we need to have some sort of level playing field in order to make sure we can do it fairly. However, some have asked that this regulation was over-regulation, unnecessary. Some people came out and said that, and asked where the legal authority came from. But as I've already said, the statutes, the legislature says, I shall. I don't have a lot of wiggle room there. We have to do it. So the authority really comes from the state legislature, and they're directing us to do this. The other part is just the fact that, is it overreaching? Well, I'm not sure, but, we did look at the 25 other municipalities that have successfully implemented this. And I haven't heard a lot of negative feedback going on in their communities. There's growing pains with any new inspection program. We have to learn the logistics for doing it. But those will be more internal complaints about us, geez, how can we do this better, than the fact that'll come from the establishments themselves. I think they'll be satisfied with our service, but we just have to figure out how to be more efficient at how we do it. So we'll be one of those, we'll start by crawling, and then we'll start walking, and then we'll have it under control pretty quick. Another question that was often asked was, how's this public health? What's this got to do with public health? In today's world, any communicable disease is just an airline ticket away. I've spoken to you before and over the years about scary things that just happen to pop up, and unfortunately, that's true more so each day. So it seems in our global marketplace, in our small world. There are potential bacterial diseases that you might not think could be associated with this sort of thing, but certainly Staphylococcal aureus. You may think it's something you don't have, but it's on all of our bodies. It's a very common bacteria, common in our noses, for example, and it belongs outside our skin. But if it gets in the wrong places, it can cause tremendous infections and problems. And the one that you can think of most is methicillin resistant Staph aureus, locally or commonly known as MRSA. So MRSA is something that can easily be transmitted in any of these salons by contact, even doing their profession correctly. If the patron comes in is ill or has that, they could pick it up from the patron, the worker could. By the same token, then the worker could pass it on. Not cleaning, having proper sanitation for the equipment could also pass that on. So the regulations do say, and give the provider the right to say, gee, I'm sorry, but I think you have a communicable disease. I can't service you. And the person can get all sorts of mad, but they're going to have to talk to us, and we'll explain to them why they can't do it. By the same token, if the worker's sick, we'd expect the owner to send that person home that day. And sort of say, hey, maybe you need to take a day off today, and we'll have somebody else cover for you. Certainly streptococcal infections are common. That's a bacteria that's all around us as well. And again, that gets in the wrong place. It can lead to sepsis and basically a blood poisoning. So you don't want that, and we don't want that in the community. We don't expect people to go and get a service at a salon and then bring something home to their home, family, schools, workplaces. That is why this is public health. Fungal infections are certainly there. Ringworm, athlete's foot, common things that folks that maybe work out in public gymnasiums or public gyms might be very cautious about, but yet the average person going to a salon wouldn't think about it perhaps in that environment. And then of course there's the dangers of the viruses, things like the hepatitis family, HIV family, things like that, which don't happen. We don't know of that happening, but could it happen? The potential is there. And last, parasites, lice. Who wants to go and sit in a chair after somebody was there with lice? So there's just lots of reasons why old school public health is alive and well, keeping an eye on these sorts of establishments at this point in time. The proposed ordinance supports and promotes the health of the providers, as I was just saying. We want them to be healthy, and we want them to be protected. And we want them to be able to perform in surroundings that are appropriate for whatever it is that they're doing. So really, we're looking at that environment. We're looking at the box in which they work and making sure that it's in good shape, it's clean, it's got proper lighting, plumbing, all of that. That's all part of the plan review process. You don't want to come in and find out, oh, hey, this is a great facility, but you really should have put the hand sinks over there, because it's a lot easier to do that on a piece of paper than it is to actually get the plumber to come back. So that's part of what's important in that. And the Department of Public Health, as I said, licenses the individuals. So we're not trying to get into the complaints about my hairdresser did this, my nail technician did that. The nail technician part we'd probably have to look in because they're not licensed. But if you're a licensed professional, really, we're going to refer that into the state health department because they're the ones that control that license. They're the ones that give that privilege to practice. And they're the ones that can do the investigation and make a determination as to whether or not that complaint is real or not real. So again, we just want to make sure that person had the opportunity to do it right. If they do it wrong, it's their license that they'll have to worry about. It should be noted that the regulations, because in some ways it seems maybe difficult, but some of these activities do generate what's called regulated medical waste. It's waste that may or may not have bodily fluids or may not have some blood contamination. We are not trying to deal with the control of regulated medical waste, we want to make sure that they have a plan and policy in place to handle it. Bloodborne pathogens are actually controlled by OSHA. That's an exposure of workers to potentially hazardous blood contamination. Some of those diseases I spoke of earlier would fall in that category. And the other part is actually the removal and the disposal of regulated medical waste, which is actually the Connecticut Department of Energy and Environmental Protection. So it's not a function of us as the health department or you as the town in those particular cases. Those are really much more federal standards that have to be adhered to. And again, enforced by those agencies. We could get a complaint, but we'd have to pass it on to those agencies. There is a concern we heard about health records, medical records, HIPAA. Not sure why that came up as a comment. These are not health programs, these are not health procedures. But there are specific reasons why record retention is important and that we get to see those record retentions. In several of these categories, specifically tattooing, body piercing, and tanning salons, the legislature has passed age restrictions. And we need to be able to verify that the age of the patrons that are there are proper to that particular age restriction. It's really more of a criminal evidence than it is health evidence. Because if they are showing that they have people that are underage that they're treating, I'm going to turn that over to Chief Grove. So, I mean, it all depends on what's there, but we have to look for it. By the same token, if there's an allegation that somebody was there that's a minor, we need to be able to investigate that complaint to find out was Jane Doe or John Doe actually proper age when they came in. So that documentation will be the responsibility of the owner again, because it's not really the technician, it's the owner that's handling that aspect of probably the policies for that establishment. In conclusion, I would just like to say that West Hartford definitely enjoys a high quality of service from these individuals. We do not get complaints, we do not get concerns from the majority of all the establishments. We estimate there's about 150 plus or minus. There's always new coming in, and there's other ones going out. So we estimate it's 150. The licensed professionals are tremendous, stellar. We get no referrals from the state health department to look into anything. So again, high standards are here already amongst the providers and I think the patrons have that high expectation too, that they're going to get that service. But there are always the outliers, and we do have some outliers. So this ordinance supports the efforts of those individuals, and it supports it by our helping or working with or directing the operator or the owner to do it in a positive way and to be able to have them have standards that they can meet or exceed. So we're not going out to try to catch anybody doing something, but we are going to give them that opportunity to be stellar, to get above that. There's no reason why you can't be better than the standards we've set, and satisfy your customers, because that's what their businesses are really all about. And with that, I'd just like to thank you once again on this lovely August night for considering this ordinance tonight. And I would just invite Amy to certainly stand next to me. And if there's any technical questions that you have at this point in time that we can assist you with, we'll be glad to do our best.
Thank you, Mr. Huliet. I think, can I just ask a question? We received one communication that you addressed some of the items on from Mr. Liftig, Dr. Liftig, actually, very involved in Elmwood Business Association, and was concerned about a lot of different issues. Has anybody responded to these particular issues to him? Or?
Not to him directly, no, we didn't. To be honest, I came in while we were on vacation. Amy and I were both on vacation. We'll be happy to sit down with him and review that. Some of that came out of I think some of his membership over there, or at least one individual over there, because we did hear a lot of that when we did the listening session at Park Road that I referred to earlier. So it wasn't a surprise. It was Dr. Liftig wasn't there that particular day, but a member of the Elmwood Merchants group was. So some of that we did hear previously, and as I said, we took that and incorporated the best we could to correct those types of concerns where they were real, for lack of a better term.
It does sound from the communication that there was a little misunderstanding on this was passed by the state, this shall be regulated, and there was more power that the town had to, a flexibility that the town had.
Correct.
So we just want to make sure
Correct.
that that's clear and that there's a
Yeah,
good
we'll-
understanding.
We'll
of-
be happy to meet with him and share that. Yeah, those sort of first 4 bullets he had really are sort of like,
Right.
you know, why is West Hartford doing this when the rest of the world isn't? Well,
Right.
the rest of the world's already done it, and we're sort of late.
Right.
Later than the rest of the, as I said, the surrounding towns are. So hopefully we can set up an appointment with them and go talk with them.
Okay, I would appreciate that. Any questions from my colleagues? Mr. Winograd?
Thank you. Just continuing on that point, Dr. Liftig did mention a few legal concerns. I guess it's more of a question for Attorney Allaire, whether or not we've checked into those specifics. Did not seem to me as if there were any, but I'd defer to your expertise.
Yeah, specifically, he mentioned HIPAA, though as Steve has already commented on HIPAA, I don't see HIPAA as an issue at all. He also mentions the ADA specifically and states that employers are prohibited from asking about communicable diseases that their employees. Always an employer-employee relationship. It is often the case that salon owners own the salon and lease a chair or lease a space to an independent contractor who will work in them. So I'm not sure that you have a true employer-employee relationship there in all cases. But that issue aside, the ADA has very specific provisions that do allow employers to ask employees about medical conditions that they suffer in a couple of different cases. One, when it affects the employee's ability to perform the essential functions of their job, and I think arguably communicable diseases in this setting do. And two, when those employees pose a direct threat to themselves, their coworkers, or others. And that is precisely the reason why we are regulating that, is because of the concern about the direct threat. I think the important thing to remember is in the context of the provisions in the ordinance addressing communicable diseases, it simply, as Steve mentioned, requires the creation of a policy. It doesn't require that you say, oh, you have a communicable disease, perhaps Hep A, Hep B, Hep C. You can't work. It says you have to have a policy, and it says that if somebody has an active outbreak, the policy has to say, go home. It doesn't say that you're prohibited from working altogether. So I think there's a distinction to be made there. Overall, I don't see an ADA issue. I really don't think there is one. Though I certainly appreciate the question being asked.
All right, thank you.
Thank you, Mr. Winograd. Mr. Dodge?
As a follow-up to Mr. Winograd's question, under the definition of communicable disease under this ordinance, would HIV/AIDS be considered a communicable disease?
It is considered a communicable disease just by its very nature. As I said in my comments, the potential of it is there, the real actual risk of it is not.
So-
The individual, you know, to spread that actually requires direct bodily fluid contact. It would require an individual to get somehow an open wound, and that open wound to actually be introduced into an open wound of another person type of thing. Again, that gets into the bloodborne pathogen part, which is OSHA, regulated medical waste part. It's all interrelated in laws that have been developed, you know, back during the 80s to protect individuals that have certain diseases. With the accommodations component, I just stress for Mr. Winograd that really we would work with these folks, as Pat said, with the policy to figure out, well, how can we accommodate this person to continue to practice their livelihood? And if they're a licensed professional, that's not up to me, that's going to be with the state health department. If it's a non-licensed professional, then that's where we got to be a little bit more careful. We got to make sure these people understand what these risks might be.
And I think you should also be aware that Dr. Liftig raised questions about three specific definitions: communicable disease and infectious waste, two subcomponents in that. Those all come directly from either state statute or the state public health code, which is actually a regulation of the Department of Health. It's not a statute. Communicable disease, I took that definition and I reworded it in layman's terms, but it's very true to the original. Pathologic infectious waste and human blood, pathologic infectious waste is directly out of the statutes, and human blood and bodily fluids, I combined two definitions just to make the ordinance a little bit neater.
So I guess one concern I would have then, looking at section 145-6, sub H7, all salons shall have the following, shall have and follow a written communicable disease policy, including at a minimum the following requirements. So at a minimum, they must do this. All employees must report any communicable disease which they suffer or carry. So under that requirement, would somebody with HIV/AIDS be required to report their HIV status to an employer if they worked at this salon?
No, they would not. I do not envision that, under the other section,
I think
where we
you're-
can promulgate such rules and regulations for the effective carrying out.
Thank you.
Under the section which has this ability to develop and promulgate such rules and regulations, the confidentiality of an AIDS individual is very protected in the healthcare industry, and as the health department, we would protect that as well. So that would not be an expectation. The issue would only be if there was an exposure. Trying to find that source of the exposure would lead backwards to perhaps finding out or inquiring the status of individuals in that, what they did, what was their job, and what did they do that particular day, in order to get to understand how did that transmission happen. But that would be, that's not even part of this ordinance, that's just something that, as our public health agency for you, we do all the time.
So under that same subsection that I just cited, though, who is the employee reporting this, their status as far as having a communicable disease to here? Their employer, I assume, correct?
I think the policy would be, yes, it would be for the employer. However, again, we could accommodate that, and they could report it to us confidentially if they wished. Again, we would have to write that as part of our promulgation of rules, that individuals could let us know if they have a chronic condition, such as a disease such as HIV, which at this point in time still doesn't have a cure, but you have a much longer life expectancy these days. So that would happen. For the most part, the only way that HIV would come around would be in some sort of blood transmission, which would be more indicative of a tattooing or body piercing than any of the other types of situations where you're actually breaking the skin of an individual. And it's probably more so about the patron than it is about the worker. And neither party could actually know what their status is at the time that happens, unless they've been tested. So I think it's be an unusual circumstance that has never arisen in my tenure as your health director, and I don't envision it happening in the future.
I guess, again, reading the section, there's no trigger for reporting. It simply says that if an employee has a communicable disease, which you said would include HIV/AIDS, that they have to report that to their employer. And I guess the reason I'm bringing this up is I just have a concern whether that would be appropriate,
Right.
and maybe that's something that we should look into further.
I mean, we can make it that HIV is exempt if you wish, and I don't have a problem with that because I think it's such a low-risk type of factor. Even in my comments when I mentioned, I said it's such a low probability, but could it happen? Yes, it could happen. Is it considered a communicable disease? Yes, it is. So I can't tell you it's not. We would have to exempt it out of the communicable disease component from that standpoint. I should state that inside the realm of confidentiality for HIV, that is not something that gets reported to local health departments. However, there are roughly about 100 diseases that are reported to us annually about the community. So not everything that the employer needs to know, we already know. HIV is one of the ones that we do not know. They do not share that data because it is covered under other statutory protections.
So how are the 25 other municipalities that have like adopted standards, do we know how they've treated this, or is it just silent to?
I'm not aware there's been an incident of it. I mean, to be quite honest, that's how low the frequency of this would be. Amy has, I'll give that to you. From the standpoint of, Amy Kraus to the microphone. From the standpoint of how other ordinances in the other municipalities and the folks you talk to, have they looked into
Privacy.
HIV status?
This ordinance was also drafted using other local municipality ordinances. The language of communicable disease is the same language as Pat stated. Specifically to HIV, like Steve said, I don't see there being that issue. I don't know specifically how they've addressed it.
Sorry, thank you. Do other municipalities, they may have the same definition, but do they also have this requirement that employees report their status as far as having a communicable disease to an employer?
Yes.
Okay.
I think there may be a solution. There is a second class of diseases called reportable diseases. As Steve mentioned, there is a list of diseases that the state requires be reported. If in, I'm sorry, gave you my copy. If in that subsection 7, Romanet 1, we said all employees must report any reportable diseases rather than communicable diseases, that would exclude HIV from the list. I believe that's correct. And be obviously some other diseases as well. We'd leave in the definition of communicable disease because active outbreaks are addressed in the subsequent subsections. And I'd add a definition of reportable disease pulled, I know there's one in the state statutes, and I've forgotten where it is exactly, but I can pull it from the state statutes or make reference to the state's published list. And that would narrow it up. And I don't believe that that would be a substantive amendment because it actually shrinks what's required to be reported. So if that was proposed by way of an amendment during your deliberations later, we could do that.
Thank you. And I do apologize for bringing this up now. I'm literally reading on the fly. And so-
No, it's a good question. It's a good scenario question. Keep in mind that even whether they do or do not report, the ultimate enforcement is ours. Our decision is whether it would be still at play. We'd be deciding what that outcome or expectation would be. Does that mean that automatically we'd go and close them? No. We'd look into what the circumstances are, and that'd be given that opportunity to tell us, well, I couldn't ask that person for one reason or another. And if that makes sense, we'd be saying that makes sense. So I think Pat's suggestion sounds positive, because that's really that's really the information we get already. But we would then have to educate for the establishments. We just have to share with them what reportable diseases we mean, and share that with them, and we can do that. And that's an annual list that gets published publicly, by the way, by the State Health Department every January. So it's not a hidden list.
Thank you.
And thank you for that clarification. So in light of that issue with HIV, number 3, he says, Dr. Liftig, potential legal issues with the language, putting the town at risk of litigation. Are we at risk of litigation, or what is he referring to, or is?
We're always at risk of litigation.
Any good lawyer, right?
After 30 years, I know this. I don't know what his argument is there. I think it's what he refers to later when he talks about the ADA issue, about employers or employees being required to disclose to employers. I think that's what he's getting at. I don't know how that becomes a liability or a litigation risk for the town. It may be a litigation risk if somebody challenges whether our ordinance is consistent with the ADA. I think it is. I think employers under the ADA do have that authority to ask. You don't have the authority legally under the ADA when you interview a pool of applicants to ask, do you have HIV? What you do have authority to ask after you've hired somebody is, do you have any diseases that affect your ability to perform your job or are a direct threat? And I think in this case, both of those are legitimate considerations and questions. And I don't see how that's an ADA violation.
So if an individual is just contracting or renting a space or a chair, then are they also subject to this as well?
They would be subject to the ordinance, yes. And that's not even employer-employee relationship, that's a contractor relationship, and I'm not sure that there is any concern about the ADA in that situation. Or if it is, I think it would arguably be the same standards that apply, or a parallel set of standards.
Hello, Denise, do you have a question? Motions. Thank you, Ms. Kerrigan. Mr. Barr?
Thank you. Just a couple points to follow up on, starting with Ms. Kerrigan's point. The language of the proposed ordinance talks about all employees must report. So if someone is a license holder that simply is, renting space in a salon, they are not technically an employee, and I think Mr. Allaire already made that point. So under this language, they would not be required to provide this information to their employer, the salon owner, correct?
Well, I'll give the first part, and I'll let Pat give the second. Clearly, if they're independently operating inside another structure, we would probably look at them as being an independent operation and subject to the licensure on their own. It's not dissimilar to when you go into some of the large grocery stores now. You may think that sushi vendor is part of that chain. They are not. They have leased that space, and we regulate them independent of the grocery store. So it depends on how far that independence goes. But if they demonstrate, we have nothing to do with those guys, we're just on here ourselves, then we would look at them like they've got a storefront in the mall, and we'd say, then you should apply to us directly. So you don't have to worry about what they're doing. And we do it for the positive reason. Then you don't want to be associated with them, because if we take their license, you're done. Mm-hmm. You're better off then in that circumstance to be your own self. However, they'd have to still make those accommodations for things like lavatories and things like that, that are shared facilities. So it would be a case by case.
And just to follow up, the ordinance regulates salons, it regulates the owners of salons, and it regulates operators, which are any people within the salon. So if you have the independent contractor situation, the ordinance does regulate operators. In general, the owner of the salon is the one responsible for upholding all of the regulations regarding all areas of the establishment, which would generally include things like record keeping. So they would have to have a policy in place. If they are hiring independent contractors as well as employees, I suppose, yes, your point is taken that the independent contractors technically wouldn't be part of the owner's responsibility to have a communicable disease plan in place for their employees. Mm-hmm. But those operators, those independent operators who are working there are also licensed professionals, and their licenses are on the line, independent of the owners and independent of the communicable disease policy that the owner, that the owner has to have in place for themselves and their employees.
Okay. So when we look at this kind of regulatory structure, top to bottom, we have a state law that says that directors of health should create a set of standards. Does the state law in and of itself provide any standards in this area?
Short answer, no.
Okay, and what I mean by this area is these
Right.
salon regulations. Are we kind of doubly regulating these businesses? The state says you must do A, B, and C, and we say you must do these other things?
There are a couple of provisions where we have duplicated the statutes, and we have duplicated them deliberately because, as Steve said, we're trying to put this all in one place so that everybody can find it. The tanning provision, and I'm blanking out on the other one, tattoos, I think it's tattoos. We took two provisions and copied them from the statute or the regulation into the ordinance so that we would certainly be consistent. Everything else is implementation of a broader level of authority. Thou shalt inspect for sanitary conditions. This ordinance tells you what the sanitary conditions are. There is a general provision, the public health code, I love this language because it's so old-fashioned. State statute mandates that town, city, and borough directors of health or their authorized agents shall, within their respective jurisdictions, examine all nuisances and sources of filth injurious to the public health, cause such nuisances to be abated or remediated, and cause to be removed all filth which, in their judgment, may endanger the health of the inhabitants. Very broad statement, doesn't tell you what a source of filth is in the community or a nuisance is. This puts some meat on those bones to get us someplace where a salon owner in the every day going about of their business knows what's expected of them. We can't walk in and go, your Q-tips are blue, they should be yellow. We're telling them what the rules are up front.
Okay. And does the State Department of Health, do they conduct any, kind of investigations or, on-site inspections of these businesses?
They have the authority to do it, but it's passive. They may inspect. What the legislature wrote for the local health departments is we shall inspect. So theirs is passive and ours is not.
Okay.
So that's the dilemma. Theirs does not specify any standards inside of it, inside of that may inspect. To get to your other part, what most of the language that is in regulation has to do with the qualifications to be licensed. So it's all about the individual. And as I stated, we're not trying to do that. So we're trying not to cross swords with that in any way. But there is no regulation for an owner, a manager. Anybody could open one of these places, have no skill sets at all, and hire people because it's a difficult job marketplace, and just go through life. But that's probably not in the best interests of the town or the patrons of the town or the residents of the town. So part of what we're trying to look at is those owners, the people that are truly making the decisions about what that establishment is going to be doing today, tomorrow, and in the future.
Okay.
So that's what we're looking for.
Okay. And in response to one of the questions that Mr. Dodge had, you mentioned that there would be, some rules that would kind of flesh some of these things out. So my question is, do you envision promulgating rules underneath this 12 or 15-page ordinance that we have here? Do you envision having another set of rules under this that fleshes out some of these issues?
Not rules, but just procedures for how we'll do it, procedures for how we'll issue the licenses, when we issue the permits, just much more policy and procedure oriented than any rule. That authority rests with you all. If we're going to do anything that changes the intent of the ordinance, we would most definitely come back to you, and we'd most definitely consult with Corporation Counsel before we make any of that sort of change. But mostly it'd be about how we conduct what we do. And some of that might be follow-up questions or follow-up re-inspections and things like that, which are things we could do internally, which don't change the nature of the ordinance or what we're trying to accomplish.
Okay.
And just make it more efficient and effective for how we choose to do it.
Okay. And I just have one question and one comment. The 14511 is the penalties section, and it doesn't set forth what the actual penalties or fines would be for a violation. Do you intend to, I guess, how would this work? Let's say somebody violates one of the provisions and they're cited for a violation. How would they know what the penalty would be for that violation?
I'll wait for Pat to find his reference, but many of the ordinances that we are empowered to carry out for you, we are able to do by being appointed as special constables. and many of them we issue a parking ticket fine. So it's it's nothing that's any more than to get their attention. We don't do it to punish, but we do it to make sure that they're listening. And that's not we don't generate revenue by doing parking tickets any more than the town. The money all goes to you. We don't collect that. That all goes through the town process. But it's a tool that you have provided us in order to make sure that they listen to us when we are talking to them about whatever ordinance that might be. So I think we have talked in terms of being able to apply that if somebody is chronically not correcting the condition. But clearly my task under the public health code, if it's truly unhealthy, we would seek to have to close them. We can't put the public at risk.
Section 1-8, the provision you cited, 145-11, refers back to section 1-8. There's a general penalty provision in the Code of Ordinances that applies when no other penalty is specified. It's in essence, the default penalty. And it's a fine of $65, but in addition to that, we adopted a number of years ago an administrative fee which adds another 14, so it ends up being $79 per violation per day.
Okay, all right. And then one last comment. Mr. Dodge asked questions about that provision in H with respect to reporting requirements, and your proposal to insert, reportable diseases. I don't know what the definition of that is, or whether that, addresses this issue, or whether it creates other issues, because now we're carving something out that may be important to this ordinance, and it's also going to bump up against confidentiality rights of individuals that have, HIV. And so I don't know if it's worth thinking about a little more than just putting in reportable and leaving it at that, or, my concern is we may be creating other issues by carving that out. And I leave that for Corporation Counsel to consider.
After we,
Let me whisper one
sure.
second.
Please.
Which you could put into your. And it's the same list of reportable diseases.
More or less.
Did you talk about this in committee? Was this part of, did you talk about this in committee?
Who do they report to, you or the manager? Okay.
Yeah.
Send them over, or give them a non-food handling position.
What I'm thinking is, rather than asking them to adopt tonight, close the hearing, draft an amendment, and have them adopt their next meeting. Okay. Steve was pointing out that there is a provision in state statutes already. There's a very parallel set of regulations out there that apply to the food service industry. Food service workers, if they have an illness, which is on the reportable illnesses list, are required to inform their managers that they have something, that they're ill. They don't have to say what they have, but it's then the manager's duty to put them on a alternative duty or send them home. What we could do is incorporate that definition, incorporate that kind of an approach into this, and what I was suggesting to Steve is close the hearing tonight. We can provide you with substitute language that could be adopted by way of amendment. I wouldn't want to try to do it for tonight, but do it for your next meeting, so you'd table decision tonight, and we'd come back to you with that minor amendment for your first meeting in September.
Okay. I mean, the goal is to provide an ordinance that a business is
Right.
going to know what they're required to do. And we give them that clear guidance, say, this is what you should do, and as an employee or independent contractor, whatever we call you, these are what your rights are, and this is what you have to disclose, and this you don't have to disclose, whatever it is.
Right.
And so I just want to be clear that we're providing that type of guidance and not creating confusion and putting people at risk of having to disclose information that they may
Yeah.
have a right to not disclose.
Yeah, just to understand where this all comes from. To Steve, it's a communicable disease, and to the public health community, it's a communicable disease. HIV is no more or less, Dr. Liftig pointed it out, no more or less a communicable disease than the common cold. A little bit more serious, but they are both communicable diseases. And from that standpoint, from a public health perspective, treated very much the same way. This category of reportable diseases is a slightly different thing. It comes out of that food service industry thing and is something that because I was preparing for tonight, I was reading the statutes again and saw it, and that's why I thought I suggested the idea, but that works for you, Steve?
Yeah, I mean, what happens in the food industry is there's no reason why not to use it here. As I've said during our listening sessions, we've tried to make it better every time, and we're trying to make it consistent across the business communities. And it makes sense that we look at the food. We really didn't look at the food when we were talking about this one. We looked more at the massage, mainly because it's, you know, it's actually physical contact. So the difference between food is a food worker doesn't touch you. So they're not worried about getting something from you on them. You're worried about eating something from them inside of you. So the direction of the communicable disease is different. So we didn't look at it that way. But we could certainly look at it from the standpoint of how does the employee report it to their immediate supervisor or operator, and look at how that language looks and make it something similar. But the issue here is you know, the hand-to-person contact of trying to prevent the disease from the patron to the worker, as well as potentially the worker to the patron, or from worker or patron from a contaminated piece of equipment that the previous worker didn't clean properly, or the equipment didn't work correctly. So all this reportability helps us find out where in that pathway of transmission do we stop it, you know? You know, that's, I won't go into public health lecturing, but there's lots of great examples about how things can go wrong if you can't get to that source real quick and put it out. So I think that's the difference, and we just have to shift that mindset a little bit. And think about it a little bit more from, as Mr. Dodge pointed out, from the worker's point of view, and see what we can do.
Thank you.
Thank you, Mr.
Thank you. Since it does sound like we may be tabling this at the next, when we go into our meeting, I just want to flag this now. But as you guys review this and look at how you're going to define communicable disease in a more appropriate way, I think we should also look at 145-67. We were looking at 7 little I, also 7 little II, and this issue of what an active outbreak is. Because I don't quite, I think it was already brought up earlier tonight, but I don't quite know what that means, an active outbreak. And under what circumstances somebody would need to stop working because they were having an active outbreak of, say, HPV, or something of that nature. So I think that's also something that we should look at.
That one.
Just your mic.
That one's really not, I'm sorry. That one's probably really not within the local purview. That's actually, comes all the way down from the Centers for Disease Control to the State Health Department to us. As the agent of the Commissioner of Health, I'm gonna have to do what they tell me. So when it comes down to what's an active case, that would be the state epidemiologist would tell me that. And when is it over, the state epidemiologist would tell me that. And that isn't part of the ordinance, that's part of my job. So I would caution us from going too far in that venue. We could certainly see when we come back if there's something we can do to ease your concerns about what is an active outbreak. But that's really getting into the public health realm of terminology, and I would caution.
Could you tell us what you think it means?
Yeah, it means that there's somebody that's sick right now, and there's somebody that's getting sicker or about to get sick because of their exposure to that individual right now. And depending upon what disease it might be, one case might be sufficient. A case of tuberculosis is an active case of tuberculosis. And that can lead to 2 cases, 4 cases, 6 cases. You know, that first case, we have to stop. We can't have somebody walking around town with tuberculosis. So that's an old disease. It's still in our town. We still have cases. We still go out and have to observe therapy on these individuals to make sure they take their medicines every day. That's part of our job. So that's active. That's an active case, and that's active surveillance, and that's active intervention in that individual's workplace, that individual's home. So TV is not necessarily one of the concerns I have with this particular ordinance, but that would be the easiest one that I could share with you right now.
So active outbreak is, as far as your understanding, is not an active outbreak in the individual, but an active outbreak in the community.
In the public health, I am public health, I'm not your doctor. That's correct. So I am trying to make sure that whatever the individual may or may not have does not get into the community at large. That is correct. That'd be a fair statement.
Because this is talking about the employee suffering an active outbreak. And again, I do have to apologize because I'm on community development and all of this has sort of come up as through the lines of questioning that other people have asked tonight.
We can look at that language.
Okay.
I mean, as part of the same thing.
Because I take your concern that if there's an active outbreak in the community of, say, tuberculosis, obviously that's something you want.
Right. But I
To
mean, just that
avoid.
one case is active in that case, which would be similar to this particular language.
But so at what
But-
point is something active and not active in an individual?
Yeah, it's determined by the Centers for Disease Control and the state epidemiologist.
Okay, so if you
Not
could
my
just get
fault.
us a definition of that then, so that we understand what that
It's
means.
disease specific. I mean, I'm not trying to be hard with you here, but in tuberculosis, it's one case. If we have diphtheria, also known as whooping cough, we have that every year in the schools. That's if we have 3 cases. So if there's 3 cases, that becomes an outbreak. If there's 1 case, it's either a student or a teacher with diphtheria. But, you know, it depends on the type of disease. That's what becomes an outbreak. 1 case can be, but in other cases, it might be multiple cases.
We can provide you with a definition by the time.
Yeah, we can clean that language up and make it more simple as to what it should be saying. But, you know, to try to, I would be welcome, be happy to come back to any committee to talk public health with you and answer what public health terms you might have questions about. But that's probably what I interpreted that to be. Clearly, you have a different point of view and you're interpreting it differently, and I appreciate that.
Can I have my copy back?
All set.
Mr. Graham, did you have something? Anything else? Okay, we are going to go to the sign-up sheet and just see if anyone signed up.
It is blank.
Okay. Is there anybody here that would like to speak on behalf of to the subject of this public hearing? Okay, so, there is no comment from the public. I think our council is done with comment for now. If we close the public comment section, we can still, the council can still ask questions on changes made to the policy, correct?
Yes, at this point, you have really 2 choices. You can keep the hearing open if you'd like, which would allow us to come back with some changes, explain them during the hearing process, and allow the public to speak to them if they chose. Given that they're a very narrow set of questions based on this, I think you could close the hearing. You're perfectly entitled to receive technical advice from staff after the hearing is closed. Technical advice in this case would be drafting some minor amendments to the ordinance to address these specific questions, and we could bring those to you, and you could deliberate on them at the time you deliberate on the ordinance at your next meeting.
Okay, one more question. I am not going to be at the meeting and I can't call in. So we are a little lean on people that are here, so,
Because this is not a zoning ordinance, another member of the council could read the transcript, familiarize themselves with the record, and participate in the vote.
okay. So I would,
Or you could postpone it for 2 meetings till you're back.
right, okay. So I think closing the public comment section may be, there was really nothing substantially changing. These are really technical changes that we're making internally to satisfy our own, almost like we would do in a committee meeting. So I would suggest that we close the public comment section and and then have town staff come back with the changes and vote on the ordinance change at that time. Is everybody okay with that? Denise? I don't know where she went. I'm a little concerned. Okay. Are you off mute? Yes.
Here, and I'm okay with that.
Okay, thank you. All right. Okay, so that's what we are going to do. We are going to close the public hearing. And is the terminology table the ordinance vote until the adoption of the
Correct.
ordinance until the
Correct.
either the September meeting, either the first meeting in September or the second meeting in September?
So right now, you'll close the public hearing.
Yes.
When we get to the council meeting, you will table that item to a specific date. I would suggest tabling it to your next meeting. You can always table it again if you choose.
Okay, sounds good. Okay, thank you. So we are closing the public hearing. We'll take a 1-minute break. We'll be back. In a minute. Do you think, Ron, do you think it would be best to table it until I'm back?
Yeah.
So, yeah. Right.
So you participate in the whole hearing.
I mean, if you want, I'd be happy if you want me to sort of talk with them as chair. Does that make sense? Or not?
I don't think you can now outside of the.
Well, staff, that's what I mean.
Yeah, well, yeah.
But he's staff, so
Yeah.
everybody
Oh, I
involved
didn't know
is
if you,
staff.
okay, yeah.
So we can kind of, and I can coordinate.
Participate in the whole thing, you were here.
Yeah.
Oh, yeah, you can vote. That's right.
Yeah, no, so it's gonna be the second meeting in
Oh,
September.
good, okay.
That's what we're saying, but
Yeah.
as far as working out the details, maybe there
Or
will
yeah.
be a town, no, there won't be a
We'll do
town
the
meeting.
20th.
There won't be a committee meeting, oh yeah, you're right, so
We
you could
could
run
put it
by
on,
the,
and we don't have a
committee
huge,
meeting.
but we will I bet our agenda will be huge by then. Let me talk to Dallas, maybe we'll figure out, maybe he can work with them directly.
Got some serious stuff to talk about.
I know, yeah, I bet.
yeah,
Yeah,
there's
well,
a lot.
let our committee talk about it, we might be able to help make sure it goes smoother next time. Like,
Did this committee see all
oh, yeah, we know, we all blew it. I mean, we're all like I felt, it's like all three of us. All our fault. I mean, we didn't catch those. I mean,
All right.
yeah.
Probably would be good just to.
Yeah.
Should be ready by September 20th, so. And is it the due is the? 27th. Okay. All set? All set? All right, we are calling the August 23rd Town Council meeting to order. We're going to start with the Pledge of Allegiance. Roll call, Mrs. King.
Mr. Barnes.
Present.
Ms. Cantor.
Here.
Ms. Casperson's absent. Mr. Davidoff.
Here.
Mr. Dodge.
Here.
Denise.
Thank you, Mrs. King. Number 4, Mr. Davidoff.
I move the approval of the minutes of the Town Council meeting of 7/26/2016. The public hearing, 312 North Main Street, 7/26/2016. The public hearing ordinance amending administrative approval process applicable to Special Development District, 7/26/2016. The public hearing ordinance extension moratorium on approval of ground-mounted and pole-mounted solar energy systems in residential zones of 7/26/2016.
Motion's been made and seconded. All those in favor? Aye.
Aye.
All those opposed? Motion carries. And we're going to go to the public forum section, but before we do, I'd like to welcome Mr. Allaire to the table as Corporation Counsel. He's been on the other side of the table, so we're very, very happy to have him on this side of the table. And we'd like to also welcome our new Assistant Corp Counsel, Garmin, and sitting with Kimberly over here, and we're very thrilled to have you both here at the meeting, and welcome aboard. Okay. There's nobody that has signed up to speak. Is there anybody that is in the audience that would like to speak on something that is not the subject of a public hearing on the agenda, something that is on the agenda this evening? Okay. Number 6, Mr. Van Winkle.
There it is. I don't have a whole lot to report, which is good in government. That things are going on. As you know, Charter Oak School is about to open. That was a $45 million construction project for the town of West Hartford. It is on schedule, on budget, and ready to open for the new kids this season. So that's very exciting for the community. If your son or daughter is off to college, you might want to think about picking up an absentee ballot, because they're available now, and they can take that ballot off to college and make their choice and get that mailed back in. But outside of that, I really don't have anything. If there's a question you might have, I'd be happy to answer those.
Thank you. I think we were going to have our Director of Public Health, our Health Department, talk about a couple of items under this.
Thank you for reminding me. There was a report from the State Health Department that we have a mosquito catching station at Spice Bush Swamp that captures mosquitoes and tests them to determine if there is any disease. And they did find mosquitoes with West Nile virus. So first of all, it's in the community, West Nile virus. There are mosquitoes that would have that. And I'm going to just ask Steve to kind of help us understand what that might mean.
Good evening, long time no see. Steve Hewley, Director of Health, West Hartford Bloomfield Health District, 580 Cottage Grove Road in Bloomfield, Connecticut. Thank you, Ron, and again, good evening, Council. Yes, Ron has asked me to speak on the mosquito program that the state of Connecticut runs, and the fact that recently in the press has been reported that 2 positive mosquitoes were found in a mosquito trapping station that's located here in West Hartford. So I'll give you a quick overview on West Nile virus, and we will make sure to put this brochure, link this brochure on our website almost immediately in the next day or so. I think there might be some extras that we might have 1 or 2 for the folks in the audience. And then a key component is insect repellent information, and that has been on our website in previous years, and we'll make sure that gets up. So West Nile virus is a virus that got identified back around 2009, no longer than that, 1999, I think. And it came across in container ships from the Middle East. That's why it got the West Nile virus name. It was a new virus to North America. It was initially confused with Eastern equine encephalitis when it first started. And it has been identified here in Connecticut, was the first place where it was actually identified by the Connecticut Agricultural Experiment Station. So they truly have the expertise here in Connecticut, down in New Haven, on this sort of vector disease pathogen, and also have been the experts on following the Zika outbreak that you may also want to ask a question or two about before we're done. The West Nile virus has a very elaborate mosquito control program that was put into place, as I said, about 15, 16 years ago. The first cases that we saw were mostly coming around the greater New York area. And to this date, that's still where there's more mosquito activity and there's still more human cases. Over the last 5 years of data, there has not been a case out of West Hartford. There's not been any ill positive individuals out of West Hartford. And up until this year, there have not been any trapped positive mosquitoes in the last 5 years. The mosquitoes become infected from the migratory bird population, which comes back and forth, north hemisphere, south hemisphere, go back and forth. So as that population becomes more infected themselves with West Nile virus, certain species bite on birds and bite on humans. There's lots of species of mosquitoes, and they pick and choose where they get their meal on species specific. So there's this one nasty creature called Culex pippins, and Culex pippins bites birds and bites us. So therein is how we get exposed to West Nile virus. Once the mosquito has it, they get to share it with us. So basically what happens with Culex pippins is they like to live in stagnant water, but they like pools of water, things like catch basins, buckets of water, bird baths, for example. So the best thing to do with that is to make sure you turn the water over every 7 days. The life cycle is 10 before they mature. So if you have a bird bath, by all means enjoy it and let the birds enjoy it. But by all means, every Sunday, dump it out, put fresh water, and start over. If you have buckets of water, I don't know why you should have them. We'll have one of our health inspectors talk to you about that. But as we look at that sort of stuff, that's how you control Culex pippins. They're an evening and night biter, so a morning and night biter, so dusk and dawn. So the time when we're at risk is at our summer camps during the summer when we send our kids to camp first thing in the summer. Many of our parks are in wetland type areas or have water sources nearby. And in evenings where we like to be outdoor dining in West Hartford Center. So a place where historically the town has put some effort has been to treat the catch basins in those areas. It's a very simple process. It's just they have they look like little donuts. You've probably seen them at your hardware store. You get like 3 in a package. And you just can break a piece of them and you can put some in the catch basins. And over the past years when we had mosquitoes more positively, that was something that Public Works would either do through a contractor or do in those areas to try to just lower the risk. This mosquito travels pretty far, however. So he can travel, he or she, actually it's she's that are doing the eating, 1,500 feet to maybe even a little farther, so maybe up to a quarter mile. So they'll go pretty far in order to get a meal. So that's what sort of makes them difficult to control, because there's probably not any household around that's not probably within that distance of a pond or a pool or something. However, in wildlife, the aquatic waters where you have fish and other wildlife, they eat these mosquitoes, so that's not really the problem. The problem's more our swimming pools and maybe the swimming pools that we don't take care of as well as we should, or other places of water. So what we have is this testing station that on the public website, it says it, so I'll say it is located in Spice Bush Swamp. It's been there throughout the entire time of monitoring for West Nile virus. This particular year, the report that I was able to download after Ron asked if I could speak, they've tested almost 1,900 mosquitoes, and they found 2, one of which was Culex pepens, and the other one was Culex restans, which is another species of mosquito. So roughly out of 1,800 that they've tested, 2 came back positive, and that happened on August 9th, according to their report. So it's in their August 15th report, and that's why you're hearing it in the news now. So the key there is dump out your water. Don't keep standing water around for more than 7 days. The effect of droughts oftentimes, certainly as the disease went west, when you had a drier summer, believe it or not, the disease rate goes up. Not exactly sure exactly the entomology of the mosquito, but somehow they're more ferocious and voracious in their consumption of meals after they have been dormant all summer for some reason. And they must go out and just attack the birds, or maybe it's because there's more birds around at that time of year. I really don't know enough about that phenomena. So this year sort of fits that. We had sort of a dry summer. So maybe we might be in for a bit of a mosquito issue. So the key is protect yourself, protect your loved ones. Inside on the back of that pamphlet right there, you'll see that there's a list of personal protection cautions. This is also something we routinely put up on our website every year. Statistically, the West Nile virus gets into the mosquito population on or about August 1st. So the fact that on August 9th we end up with positive mosquitoes is predictable. The key now is to make sure that we don't have more and put ourselves or our residents or our folks who come to do business here in town at risk. If that happens, I will be coming back to you and sort of saying, we have an active outbreak of West Nile virus now, and we need to probably do more to protect the people at dusk and dawn. Ron?
If you could just comment on Zika also while you're here.
Certainly. Zika is caused by a completely different species, and in Connecticut, we are very fortunate that that particular Aedes aegypti and Aedes albopictus do not live in this latitude. It's too cold. They just aren't here. So what the state mosquito program is doing is looking at the southernmost part of Connecticut to see if any of them show up. They are down toward New Jersey, Maryland, that way. The albopictus mosquito can live in that temperate zone. The aegypti does not. The aegypti is the bad character in this play. This is the 7th outbreak of Zika that they've recorded since the 40s. It came out of Africa, skipped around Africa, a couple outbreaks, went over to India, caused an outbreak, went to Malaysia, caused a big outbreak, and then during the World Cup soccer tournament that was 2 years ago in Brazil, it made the jump from Malaysia to Brazil. So now it's in Brazil and South America, and unfortunately, certainly for the folks in Miami, it's in Miami. So the other issue with Zika is those mosquitoes don't carry the Zika virus in them. They give it to a person, but then another mosquito feeds on that person and then transports it to the next person, whereas Culex pepens actually has West Nile virus in them. So they're actually the host. In this case, these aren't hosts, but they bite the person that has it and then takes it to the next person. So in Connecticut, the specialists down there at the Connecticut Agricultural Experiment Station say we are definitely not at risk this year because there is not a burden of Zika in our population. So even if the albopictus mosquito shows up, there's no place for them to actually get the virus from at this point in time. As more people travel and come back and have Zika in their system, that could change. So, waiting to see on the science on that. The potential for a vaccine is certainly something that the federal government's trying to find money to see if they can expedite that, to see if they can stop that. But in both cases, West Nile virus and Zika, if you are exposed, your symptoms will probably be mild, except with Zika, if you're pregnant, you could have a bad birth outcome. That seems to be running. I think they're still trying to figure out the statistics for what the prevalence of that is, what that attack rate is for microencephaly. But clearly that would be a birth defect for the life of that individual, that child. With West Nile virus, it's the risk of If you have other health complications, it can lead to pneumonia, or it could lead to an encephalitis type of condition, which would require hospitalization and good care. So both of them have different consequences. West Nile virus, for those that maybe have other health issues or are somehow immunocompromised or in some sort of situation where they can't fight it off as easy. For healthy people, you may have already been exposed to West Nile virus over this 15 or 16 years that it's been here. So they're both cyclical. They're both going to be around for a while. And they're both probably going to burn out, so to speak, just as Zika has done the other 6 outbreaks. It just sort of seems to get endemic in the population, and then there's just not that many people at risk at that point in time. So in both cases, the plan's the same. Protect yourself from mosquitoes. The Zika mosquito is different. It's an all-day biter. It does not travel. It likes to get into an apartment complex and just bite everybody that's there. It doesn't fly very far. So that's why the Miami case, you're seeing they're just focusing on those neighborhoods, the Windward neighborhood, now over on Miami side, because those mosquitoes don't go anywhere, whereas Culex pippins, they go fly around. And their breeding is tougher. They breed in litter. They don't need a big bucket of water. They just need a little bit. They can breed in the knots of trees. They can breed in a soda can on the side of the road. So it's really important and a good thing for West Hartford. We are very aggressive and have a strong litter and community standards ordinance. And we don't have a lot of debris, and if we do, somebody's going to tell us, and we're going to go out and look at it anyway and tell them what to do with it. But in those urban areas where there tends to be more of that, think of Rio with the Olympics, water everywhere, big buildings everywhere. You can see why the health officials and public health officials were so concerned. So that's a quick piece on Zika and the current status of West Nile virus and the 2 positive mosquitoes found last week or 2 weeks ago.
That's all we have. If there are any questions, I'd be happy to answer them.
Thank you, Mr. Van Winkle. Thank you, Mr. Juliet, and thank you so much, Amy, for being here. Anybody? Yes, Mr. Davidoff.
Thank you, Madam Mayor. Mr. Manager, I had a question about the upcoming presidential election in particular. Absentee ballots are going to be available when?
Absentee ballots are available now
Okay. And the people can procure them at the town clerk's office,
at
correct?
the town clerk's office, yes.
Okay. With respect to the hours of operation of our Registrar of Voters office, can you tell me the current hours of operation for that office?
Yes, at this time, the Registrar of Voters office is open on Mondays from 1:30 to 4:30, on Thursdays from 12:30 to 6:30, and on Fridays from 8 to 1:30.
Thank you. It's my understanding that the mayor and the minority leader are going to meet with the registrars to see if we can encourage more hours of operation prior to the upcoming election. So I'd be interested to hear how that turns out. Thank you.
Thank you, Mr. Davidoff. Mr. Winograd, do you, no? No? Okay. Thank you, Mr. Van Winkle. Number 7, Mr. Davidoff.
I move that we place items 10 through 16 and 20 through 23 on the consent calendar.
Motion's made and seconded. All those in favor? Aye. All those opposed? Motion carries. Number 8, Mr. Davidoff.
I move that we table the ordinance regulating barbering, hairdressing, cosmetology, nail, tanning, tattoo, and body piercing salons to the council meeting of September the 27th.
Motion's been made and seconded. All those in favor? Aye. All those opposed? Motion carries. Then we go to,
Sorry about that. When, we extended it to what date?
September 27th.
Okay, so 2 meetings out?
Yes, and the public hearing was closed on that, so that's just as part of the record. Okay. We're at number 17 then, correct? Number 9. Oh, I'm sorry. Oh, geez. Sorry about that. Number 9, Mr. David.
An ordinance amendment application on behalf of Lex and West Hartford owner LLC to create a new section for the alteration of floor area ratio standard in the BC zone. I move we set for public hearing on September 27th, 2016 at 6:30 PM in the legislative chambers and refer to TPZ and CROG.
Motion's been made and seconded. All those in favor? Aye. All those opposed? Motion carries. Now we move to number 17. Sorry about that. That was a big one. Let's see, I have a few. Before I start announcements, and I meant to do this at the beginning of the meeting, there's many people that pass in our community that should be mentioned, but this particular gentleman was really made a mark on the state of Connecticut. This is Judge David Borden. He passed away a couple of weeks ago from pancreatic cancer. And I just wanted to read a quote. It is difficult to find the right words to describe the incredible legacy of Justice David Borden, said Chief Justice Chase Rogers. He was a brilliant scholar whose body of work will have a lasting impact on Connecticut. He believed deeply in the rule of law, open and transparent courts, and access to justice for all. And he was extremely highly regarded by his colleagues on the Supreme Court and by lawyers. There was universal admiration and respect for his intellect and his approach to issues. He is survived by his wife Judy and 3 children. And he had, in 1977, he was named as a judge of the Court of Common Pleas. He was president of the Connecticut Judges Association from 81 to 83. He became a Superior Court judge in 1978. He became... On April 15 to 2006, 2007, served as acting Chief Justice of the State Supreme Court. And I know that he will be deeply missed by his family, and we're grateful for the impact he made on the state of Connecticut. And now for announcements. Applying for an absentee ballot. I think we talked about that a little bit, but the absentee ballots are available now. If you are absent from the town during all the hours of voting, you need to do this for an illness reason, physical disability, active service in the armed forces, duties as an election official at a polling place, or religious tenets. The issuance of an absentee ballot is a two-step process. You can download on our website an application, and then you apply and you receive the ballot. Mail all completed applications as soon as possible to the town clerk's office, room 313, 50 South Main Street, West Hartford, Connecticut, 06107. We must receive the voted ballot back in our office by Election Day in order to have the vote count. The Global War on Terror Wall of Remembrance comes to West Hartford August 25th through 28th. This August 25th, 28th, the Connecticut Friends of Veterans, Inc. will bring the Global War on Terror Wall of Remembrance to West Hartford's Town Hall front lawn. The memorial has nearly 11,000 fallen heroes, victims from the Global War on Terror. The timeline covers Beirut, Desert Shield, Desert Storm, Somalia, Bosnia, USS Cole, Afghanistan, Iraq, Fort Hood, Benghazi, Boston, Massachusetts, Chattanooga, Tennessee, and San Bernardino. The uniqueness of this memorial is that it's perpetual until the U.S. government declares the Global War on Terrorism campaign to be closed. The huge block of names are reminiscent of the Vietnam Memorial Wall, but this memorial has added an element, a backside with pictures and brief text of events dating back to 1983, when 241 military personnel were killed by a truck bomb while stationed in Beirut, Lebanon. The 3 decades of history include September 11, 2001 attacks in the U.S. and the wars in Iraq and Afghanistan. Over the 4-day period, there will be ceremonies, programs, and performances that will be part of this commemorative weekend, dedicating to honoring all of the veterans and those presently serving in our armed forces. We expect over 20,000 veterans and civilians in attendance, said Ray Philippon, event coordinator with Connecticut Friends of Veterans. There will be a ceremony at 7 o'clock on Friday night, the 25th. Cycle and stroll at West Hartford Center Street, Sunday, August 28th, 9 through 12. Folks of all ages are invited to take to the streets for a carefree and car-free summer morning in West Hartford Center on August 28th, 9 to 12. It's the first ever Center Streets, and it closed 4 roads that will form a rectangular loop around the Central Business District, Farmington Avenue, South Main Street, Memorial Road Extension, and LaSalle Road. Ride your bicycle or scooter or take a stroll down the street without automobiles. Families with young children are especially welcome. Participating stores will be open. There will be food for sale, and live music will be performed all morning. Fern Street Community Kitchen, free community breakfast. The Fern Street Community Kitchen has free community breakfast for neighbors in need at the Universalist Church, 433 Fern Street, West Hartford. Every Monday, Food Share mobile truck will be distributing food in the back parking lot from 8:45 to 9:30. Breakfast is served 9 to 10 on August 29th, September 12th, and September 26th. For more information about the Fern Street Community Kitchen, call 860-233-3669 and sign up for a free 7-week diabetes self-management plan. The West Hartford Bloomfield Health District, who just, our director just left, and assistant director, and Connecticut Department of Public Health are offering free 7-week diabetes self-management workshop in fall 2016. Snacks will be provided for each session. Whatever. Call 860-561-7900 to sign up. So, anybody else have any announcements? No? Okay, moving on. We're really moving on to the number 24, Mr. David.
I move adoption of the consent calendar.
I'm sorry, 18. Oh, I'm so sorry. We do have a report, too. Ay, ay, ay.
That
I
would
need
be
new
me,
glasses.
yes. I actually do have a couple of quick things. First of all, just to follow up on the question asked of Mr. Van Winkle earlier, I wouldn't want people to think that when the registrar's office is closed, they can't register to vote. You can register to vote online. You can register to vote at motor vehicles. There are other vehicle opportunities to register when the registrar's office isn't open. The other thing, as a point of personal privilege, my first job after law school was clerking at the appellate court when Justice Borden was there. I spent 2 years with him, and in my entire career, I can truly say there's no higher honor than having Judge Borden say, "Good job on an opinion you wrote." He was a brilliant man. He was a kind and wonderful man. He was a resident of West Hartford, and I didn't know he'd passed away, and I'm very sorry at the passing. Third, we have our newest member in the of the office in the audience, Garmin Newsom II, not to be confused with his father the first, I assume. Garmin comes to us from the West Coast after 10 years with the City of Renton City Attorney's Office in Renton, Washington. He was also a pro tem judge, which sounds like an interesting gig. Before that, he was with the Office of General Counsel to the MTA, the New York City Transit Authority, the Bronx County District Attorney's Office. He was also a special narcotics prosecutor. He graduated from GW Law School and Morehouse College. We are very, very lucky to have him. Garmin, please stand up and say hello to folks and take your embarrassment like a man. And Kimberly, as you all know, has been in the office for 11 years and has moved up to the ranks of deputy, which is going to play out nicely on the 27th, because you've continued everything to the 27th, and I have plans to be out of the country that day. So Kimberly will be sitting in this chair for that meeting. Regrettably, we do need an executive session, but it will be brief, to discuss the possible settlement of a pending claim or litigation.
Thank you very much, Mr. O'Leary, and I apologize for that. I don't know what. Okay, we actually have no appointments, and now we are going to move to number 24, Mr. David.
I move adoption of the consent calendar.
Motion's been made and seconded. All those in favor? Aye. All those opposed? Motion carries. No communications, no petitions. We are going into executive session. We'll be back to close the meeting. You can wait around or not.